You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, an extreme makeover edition of the Wellness Hour. If you are unhappy with the way your face is aging, you have to hear what my first guest has to say. Board-certified plastic surgeon, getting a lot of attention because of his natural results. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. With us, we have board-certified plastic surgeon, Las Vegas' hottest plastic surgeon, Dr. Frank Stile. Welcome to the program.
Good to be back, Randy.
You're always a great guest, and we had to have you back.
Well, thanks.
What have we talked about? Breast on the show, liposuction, tummy tuck. For those people that don't know you, tell us a little bit about your practice.
I'm lucky enough to have one of the busier cosmetic surgery practices in Las Vegas right now. I do the full spectrum of cosmetic surgery procedures, including breast lifts, enlargements, and reductions, body contouring procedures, liposculpture, and tummy tucks. And a large part of my practice is also facial rejuvenation surgery. I do everything from brow lifts, eyelid surgery, face and neck lifts.
Now, the facelift patients, and that's why we invited you on the program today, are they getting younger and younger, older and older? I mean, it's becoming mainstream now?
Both. Believe it or not, our patients are getting younger, and they're doing what we call maintenance facelifts, just to keep themselves looking younger as they age. And older patients who are now exposed to these procedures through things like your show and information on the internet and on television, that realize that these are procedures that can benefit them.
Now, your background and training, board-certified plastic surgeon.
Right. I've done 12 years of postdoctorate specialty training at 4 strongly academic institutions. I've done general surgery, hand surgery, reconstructive microsurgery, and plastic and reconstructive surgery as well.
What's changed over the years when it comes to facelift?
The traditional standard procedures remain the same, and in my opinion, those are the best. But what you hear a lot more about over the last 5 or 10 years are these smaller procedures using more limited incisions.
Like low downtime facelifts.
Correct, and the claim is that the results are comparable, and the selling point to many prospective patients is that there is less downtime, it's a smaller procedure, and most importantly to some patients is that it's a lot less expensive. And in reality, you get a procedure sometimes that looks good initially and might not last as long as a more traditional full facelift.
Are they just neck lifts? We've talked a little bit off camera. I mean, some of the national advertising with these facelifts, are they just neck lifts?
No, they're
What's
both.
Your take
they're
on
both usually mid-face and upper neck rejuvenation procedures. But once again, if you do a smaller operation, logically you're going to get a smaller result, or a result that doesn't last as long. I mean, that's my observation.
But you're big on natural results.
Yeah, absolutely.
I mean, to you, and I told you off camera, I said I feel like I could spot a great facelift, 10 yards away or at a party.
Well, if you're spotting a great facelift, it's not a great facelift.
Okay.
I mean, what you're looking to do as a facelift surgeon is give a patient a look that's reminiscent of what they were 10 or 15 years ago. You don't want to change the way they look. What you do is want to make them look younger. That's it. And you shouldn't be able to spot it.
Who's the typical patient coming in for a facelift these days?
Well, in our community, the typical patient are both men and women who are getting a little bit older and don't like the way they're aging. The age range is great. Everyone from their mid to late 40s to mid to late 60s.
Is that right? Late 40s.
Absolutely.
They're getting is a lot of Hollywood, you think? Facelifts, is that your hunch?
I think that there is a Hollywood influence on the facelift population. Most people don't realize that actors and actresses are having what they call maintenance facelifts earlier.
Yeah, what does that mean, maintenance facelift, by the way?
Well, they're not having them because they look old and want to look dramatically younger. They're having them because they want to maintain the look that they have for a little bit longer.
So getting a facelift these days is not just for the rich and famous.
No, it really isn't. That might have been the conception 20 years ago, but today I have everything in my practice, both male and female, everything from homemakers, retired folks, patients that are in the workforce that want to look younger so that they can remain competitive or just feel better about themselves.
You say some people get a facelift and they feel younger. They report that they feel younger.
Sure. Well, I really can't explain it, but I see it in my photos. You know, I have patients whose hairstyles change, their style of clothing changes to a more youthful one after these procedures. I think it has a lot to do with them looking at themselves in the mirror and not seeing that older person anymore, or what they perceive to be a person that was a lot older than they'd like to be.
Okay, do you like to think of yourself, because we've talked, as a guy that attracts the patient that wants a natural look? They don't want to look different, they want to look natural?
Absolutely. I think a lot of that is emphasized during my consultations. You know, they come in and give me their concerns. We look in a mirror together.
And what do they say, by the way, on a consult? I mean, when they're unhappy with their face, what do they tell you?
Well, look in a mirror together and I'll say, what is it that concerns you? What have you noticed have been the biggest changes over the last decade? Sometimes I'll have them bring a photo of themselves 10 or 15 years earlier, and we'll look at the changes together, and systematically we'll discuss what can be done to improve these things.
What do they say? What do they say? What don't they like? Is it always the neck, the jowls, the eyes?
All of the above. You know, they'll look in the mirror and say, hey, you know, when I see myself now, I don't look like I feel. I feel a lot younger than I look, and they'll get pictures of themselves taken at different occasions, and they'll be very unhappy with how they look. They'll say, hey, these photos aren't flattering anymore. You know, I don't feel like I look. I feel a lot younger than these photos would tell you I am. And they long to have that appearance again.
So the frequently asked questions, what are they? Are they about their fears, their hesitations? I guess people don't want that pulled back tight look.
All of what they say is, first of all, they're afraid of the scars. Where are the scars going to be? You know, they have friends that may have had facelifts with other doctors. They say, you know, she can't put her hair up anymore. She can't stand on the buffet line with someone behind her without worrying that someone's going to notice their facelift scars. And that doesn't have to be like that. You know, and
that's technique driven, you're saying?
Absolutely. Positioning of scars is a operator dependent issue. They also say, hey, I don't want to look like somebody else. I want to look like me, and I reassure them, you will look like you, but a younger version of yourself. Then they say, I don't want to have a pulled back appearance. You know, almost like a wind tunnel or a look of eternal surprise.
Okay.
So to say. And you know, once again, that's all dependent on the technique that the surgeon uses.
So it's in the hands of the surgeon.
Absolutely.
But you have to have an eye for it.
Yeah.
You think you have that eye?
I think so.
Okay. Now, we've talked on your other shows, like breast surgery,
right.
tummy tuck. I mean, when you look at somebody's face, do you say, I see the end result? I mean, does it go through your mind where you can see it?
You have to be able to perceive that in order to have a good surgical plan, a good operative plan. If you can't visualize your end result, it's not likely that you're going to get there. This is not something that you want to be planning in the operating room. Okay. You know, you should know if a patient is a good candidate when you first meet them, and you look at them globally. You know, first you look at them in general. You say, hey, what is their skin like? What's their skin texture like? Do they have a lot of fine wrinkles or deep wrinkles? You know, do they have jowls? How do their brows look? You know, and you look at them in components from top to bottom, and then you give them an honest assessment of what you think they need to achieve this more youthful look.
Are there people that come in with that think they need a facelift and really they just need some less invasive procedure?
Absolutely, absolutely. And you know, sometimes that's a difficult conversation, but we have it. You know, there's some patients who are so young and so concerned about their appearance that, you know, things like fillers or facial resurfacing procedures with peels, et cetera, can give them a brighter look. They don't need
fillers and everything.
We do it all. We do it all, and that's where careful patient assessment comes in. You know, not this procedure isn't for everyone. First of all, there's some people who are happy aging gracefully, and that's great. But some patients are just really, really saddened by the changes that have happened with time, and those are patients who are my candidates for this.
Okay, let's start with the aging face.
Right.
I guess from the top down.
Well, when you see a patient initially, a prospective facial rejuvenation patient, what you look at them first is globally. You say, hey, do they have skin issues? What's the texture of their skin like? Is there a lot of sun damage? Do they have deep or fine wrinkles? This is globally. Then next you start from the forehead down. You say, hey, do they have any brow sagging or ptosis? Do their eyebrows kind of sit over their upper eyelids to make them look a little bit older or tired?
So for the brows, what do you do for the brows?
Well, with brows you can do either an open brow lift or an endoscopic brow lift, which uses small incisions to get the brows back up. Now, some patients, especially my female patients, will try to camouflage this by repainting their eyebrows a little bit higher on their forehead.
Yeah.
You know, and It helps to some degree, but it's really a temporizing maneuver. Then you look at the eyelids. Upper eyelids, do they have what we call hooding, which is a little bit of extra skin that brings the lid down and makes them look a little sleepy or tired? Okay. Lower lids, do they have extra skin? Do they have bulging, or puffiness?
With the upper lids, though, it seems that, that's another thing, and, since I met you the first time, looking around, it seems they get a hollow look. Almost can make them look older.
Well, that's where you have to be careful as a surgeon.
We're talking about the saggy
If you take out too much skin, or especially too much fat, it will give you a sunken-in look that can make you either look older or almost like you're starving.
Okay.
With the lower lids, they have puffiness and a little bit of redundant skin. The puffiness can make them also look like they haven't slept or they're tired. And that's the comments that they get a lot from their friends or family. Like, are you sleeping well? Are you tired?
Are you tired, yeah.
Right, and they're not, and it frustrates them. It's comments like that that will drive them into the office.
Or are you mad? That's another one.
Sad or mad, sure. Then you go down to the mid-face and they say, hey, my nasolabial folds. If something strange happens to women after
What are nasolabial folds?
It's the line between your nose and the corner of your mouth, and this is a phenomenon that happens to women after 30. For some reason, they start to look at their nasolabial folds a whole lot more. And with age, when you have your skin dropping a little bit more, you have what we call a descent of facial structures inward.
Is that what's happening? It's just the face is dropping?
Exactly, yeah. All the components are there from when you were younger. They've just repositioned into a less attractive or less optimal position. And as they drop and move inward, your nasolabial folds become more pronounced. You get something called marionette lines, which are the lines between the corner of your mouth and your chin, kind of like the marionette puppets. Okay. And then they also get a loss of their sharpness on their mandible here, which is called jowling. All of this adds up to make them look a lot older than they really are. Finally, you look at a patient's neck, and there are several things that happen. We have a very broad muscle across here called the platysma. It's usually together and holds all the neck structures up, but with time, this muscle drops and separates, which contributes to an appearance we call banding.
So is the neck one of the first things to go, by the way? I mean, that you see?
I think it's the first thing that actually makes them. It's kind of a call to action for patients. It's what brings them in because they say, look at my neck. I've lost this angle here.
Can the neck be too far gone, by the way?
No. Okay. They'll say, I'll see myself in a profile picture and I'll have like a line from here to here. I've lost this sharp angle that I had and I have this extra skin, my jowls, etc. A neck is a very important part of a facial rejuvenation procedure. It's very difficult to do either a neck alone or a face alone and get good results. They usually have to be done together.
So is neck easy for you to do?
It is because I've had a lot of experience with it. It was very challenging during my early career or in my training, but it's also a very complex area of the face to address. You have to know what you're doing real well here. The goal with a neck rejuvenation is, number one, resuspending these muscles into a position almost like a sling to bring the neck up.
Those are muscles?
Yeah, it's the platysma muscle that's opened up, and you get a band, two bands, usually from your chin down to your clavicle.
Where do you put them? What do you do?
You basically reapproximate or put together these muscles in the midline here, and then grab the edges and pull them up. That acts like a sling to resuspend your neck, and it's very important to do. It's very important to do this well to impart a more youthful appearance to your patient. You can't, once again, you can't do these separately in many patients and get an overall good result.
What do you mean separately?
Well, some patients will come in and say, hey, they want their neck done, and they don't want to do anything about any changes that might have happened with their face.
Like their upper part of their face.
Correct, or they want their face done only and not their neck, and when you tell them, they say, hey,
so you have to talk them out of it
you'll just look like an older person with a young neck.
Okay.
And it's really not what they want.
What about this? What about, somebody watching this? I mean, there's medical spas in every corner,
Correct.
And they're pushing fillers. And I'm backing up, by the way. You're talking about nasolabial
fillers.
Folds.
Why
not just do fillers?
Fillers are great for a younger or very limited patient population who do not have very pronounced nasolabial folds. They'll have a line there that can be, made less dramatic by putting a filler in. But a filler is a temporary answer to a problem that progresses with time and gets worse usually.
Okay, what's happening though, by the way, with this area? Is it fat? Is it muscles?
Well, most patients lose fat in their face as part of aging. Even though we tend to gain weight in other parts of our body, we lose it in our face. That gives us somewhat of a hollowed appearance in the mid-face. Also, you have a lot of the muscles of facial expression are becoming lax and drop downwards as the ligaments ligaments that retain these become looser with time. See, with the facelift, if you want to do it right, you have to resuspend these structures into their previous, more youthful position. In order for a facelift to be done well, you have to address the deep structures. Skin is only a covering. It is not to be used as a lifting or tightening tool.
Some guys are doing that, just pulling skin, you say.
Right. Unfortunately, what's good about skin is what's bad about skin. Skin will stretch. Skin will loosen with time. So if you're using it to impart a lift into a patient's face, it's not going to last very long. Okay. So what you need to do basically is go deep into these deep, what we call the SMAS, which is the deep layer, that invests all of these muscles of facial expression and ligaments, etc., and pull that back and up. That will impart your lift. That's really the money part of this operation. After you've resuspended these deep structures, the skin is redraped over there without tension, and the extra skin is removed. And that's the way to really get this operation done right.
We're going to take a quick break. We come back. Photos. What do you have for us?
Well, I'm going to show you some different examples of the facial rejuvenation procedures that I do, and I have some examples of eyelid surgery, upper and lower, some cosmetic nose procedures, as well as face and neck lifts.
Bags under the eyes? Is that we haven't talked about that?
Sure.
That's an easy one to take care of?
Yeah, you can, if you know what you're doing.
Okay. Could you make somebody look, I mean, like a 60-year-old look what, 5 years younger, 10 years younger?
Usually the goal is 10 or 15 years younger than what they are.
Is that right? You
Sure.
think you can make me look 10 years younger? You know my age off camera?
I think I could, Randy, but you're perfect.
Okay, well, thanks for that. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with Dr. Frank Stile, board-certified plastic surgeon. We're discussing what you need to know if you're considering any type of facelifting procedure. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. With us we have board-certified plastic surgeon Dr. Frank Stile. Okay, so we have some photos. What are we looking at here?
I brought an assortment of pictures here to help explain or demonstrate some of the issues we talked about. And this first picture was a patient who came into my office who had, believe it or not, 3 what she called facelift procedures done in other practices. And she did not understand why she didn't achieve the results that she wanted.
Why didn't she?
Well, basically because these were very limited procedures like the ones we talked about.
Like low downtime.
Right, that use limited scars and threads and other things.
You think they're gimmicky, by the way? Because you smirk when you say that.
I don't think they're gimmicky, but you know, you can't expect to have a dramatic result with a small operation. Okay. So basically, what she really needed was a full traditional face and neck lift done the way I described. You know, addressing all of the components. You know,
so what bothered her here in this?
What bothered her was the corners of her mouth and the appearance of her neck. You know, this is a person who's active in the community and works in a job that it benefits her to look younger. Okay. And as you can tell from this to this, what you see is a dramatic change.
What does she say, by the way? What do they say? When it's all done, do they say, people didn't know what they had done?
Well, they usually, well, for her, she was very, very emotional about it because she finally got what she wanted, you know, and she feels better about herself and more comfortable about herself in public.
Okay.
The next set of pictures is an example of upper eyelid surgery before and after, and what you see here in this middle-aged male is what I call upper eyelid hooding. Yeah, and if you look at this picture, I want you to notice a few things. What he has is what we call upper eyelid hooding, and what that is where your upper eyelid skin sort of hangs down over your lashes.
It's very subtle, though, by the way.
Well, right, but it makes his eyes look a little fuller and more tired.
Okay.
If you look at the after picture, what you see is his eyes look anatomically the same,
nice.
but they're lighter, they're opened up a little bit more, and he looks a lot more rested.
Yeah.
Our next picture here is of a woman who had extremely pronounced puffiness of her lower lids. She actually came into my office and her complaint was that everyone tells her she looks tired or that she hasn't slept at all, and she feels great, she sleeps
bags under the eyes.
Right, basically bags under the eyes, and that's usually caused by the fat pads that we have pushing out, and it's not always a result of aging, because I have young female patients that have this as well, and I'll show it to you
so
after.
What did you do, fillers on this woman?
Well, for her, fillers would have been the wrong call. Her issue has to do predominantly with these fat pads that are pushing out, giving her this puffiness. It's very tricky to use fillers.
So what do you do? What do you do, by the way, for this woman, then, if you're not using fillers?
We're taking the eyelid skin down through a very small incision along the lash line, and we're taking a lot of this fat out, being careful not to take too much, which can give a patient a hollowed out look.
Okay.
And if you look at the result, I mean, it's the same patient, but she looks dramatically more rested.
So do you drape it up a little bit? Are you tying up any skin at all?
Well, the eyelid skin is resuspended subtly, but once again, you have to be careful. If you don't do this judiciously, you can get something called an ectropion, where the lid actually comes down. So you just want to take enough, and that's where the artistic part comes in.
This looks good.
Okay, let's look at this next patient. He came in and said, hey,
young guy.
Yeah, he's relatively young, but he said, I look a lot older than I am. I don't like the way my eyes or my neck look. If you look at the preoperative photos, he's got upper eyelid hooding, some puffiness in his lower eyes, and he's also got this fullness in his neck. When you look at these pictures side by side, it's easy to see that the postoperative pictures make him look a lot younger than he was preoperatively.
He does. He looks fit.
Exactly. He looks rested.
Looks a little bit like Rand Seacrest.
He looks, yeah.
He does, to me, he does.
If you look at these, he looks a lot more rested. His jawline looks a lot sharper, and his mandible is a lot more pronounced, and all of these contribute to a more youthful appearance.
What does a guy like this say, by the way? He comes in, you do it, I mean, because it's obviously a great result there.
In terms of his friends and family, they say, hey, he looks a lot more rested and looks younger, but they can't quite put their finger on what he's had done, but they all say, hey, he looks so much better.
He looks like he lost about 20 pounds.
Absolutely, but he really hasn't. It's just his face and
It must
neck.
be tough, by the way, get photos from these. Because you do some high-profile patients.
Well, photos are part of all of our medical records, so we get pictures, but whether or not
you can show them on
we
a
can
program,
show them is a different story. Yeah.
Okay. So what else do you have for us?
Well, here, once again, trying to demonstrate that age is not an issue here. I have this young, attractive woman whose issues were lower eyelid puffiness. Right.
What bothered her?
The lower eyelids, once again, with her saying, hey, my lower eyelids make me look like I'm tired.
Little bags under the eyes. Okay.
Exactly. She didn't like them, and we did a lower eyelid blepharoplasty, removing some of the fat and redraping the skin, and she looks dramatically different in terms of...
again, our show airs nationwide.
Right.
I talk to a lot of these minimally invasive people that do a lot of fillers. You do fillers too. And, I'm probably more confused than ever, but they will say, Randy, this is a perfect filler patient.
Well, it's interesting that you would say that. This patient's issues were caused by fillers. Believe it or not, she had actually fat transplanted into her lower lids to try to address this crease under her eyelid, and it ended up clumping up, causing this eyelid puffiness in both eyes.
So, bags under the eyes. You got rid of a little bit of the fat. You redraped it or tacked it somewhere? What are you doing?
Actually, it's actually lifted up and tacked into the corner of the canthus, as we call it, of the eye.
So most bags are handled that way?
Yes.
For the most part?
Yes.
Okay, good. Now, in the after, obviously, beautiful before, beautiful after, very pretty. Subtle result, but very good.
Next picture is of just to demonstrate how dramatically changing someone's nose can make them look with respect to age. Here's a young woman on the right who had what we call a dorsal hump and some nasal fullness, and she almost looks middle-aged as a result of it. On the left, her postoperative picture after thinning the nose and lifting the tip makes her look significantly younger.
Yeah, and prettier, by the way. Nose is very nice. You like doing noses?
Yeah, I like them a lot.
A lot of doctors I talk to, they don't like, a lot of plastic surgeons, they say, I don't really like the nose.
Actually, noses and breast lifts are two of the most complicated procedures we have, and I enjoy doing them both, and especially because the nose is on the center of somebody's face.
Yeah.
You don't get many opportunities to do it right, so you have to pick a surgeon who has a lot of experience with it before committing to an operation like this.
We're out of time.
Okay, I'm just going to show you one or two more, Randy, all right?
Okay.
Here's a middle-aged man. He did not like the appearance of his eyelids, his mid-face with the jowling and the fullness of his neck. What we did for him was upper and lower eyelids, and if you look at his eyes are opened up a lot
Very
more.
natural, very nice.
He's got a sharper angle on his neck and mandible here because we did a neck lift on him as well, and just the overall contour of his face is a lot more youthful.
So this is a full facelift? Where'd you hide
Absolutely.
his incisions?
Well, the incisions are basically right out in the open, but if you place them correctly, they look like anatomical landmarks and not like
Where do you put
scars.
them?
Basically along the lobule and on the inside of the ear in the front. In the back, it should be on the hairline, not in the hairline.
So he looks a lot more stylish, by the way, in the
Yeah.
end. Do they do that? People start, they
Sure,
get hip all of a sudden?
They feel better, so they dress better and even change their hairstyles. Here's a similar example of a middle-aged woman who's got a lot of jowling and some pronounced nasolabial folds, and corners of her mouth are down. And we did a neck and lower facelift on her, and she looks a lot more youthful.
Yeah.
A lot happier. And finally, just once again, the major concerns are scars and scar placement. And if you look at this picture right here, the hair is lifted up, the ear is shown clearly. You can't really see the scars. They're not very dramatic or noticeable, even with your hair up, if this is done correctly, Randy.
Okay, okay. We're out of time. A recap. Keys to a natural-looking facelift.
Well, the keys, as far as I'm concerned, are very elementary. You can't get a dramatic result with respect to a rejuvenation procedure with a small operation. This needs to be done addressing the deeper structures and the skin as well. The deeper structures need to be resuspended into a more youthful position. Skin should only be used as a cover and not as a tightening tool. You have to address the face from the forehead down to the neck. If your brows are low, they need to be lifted, but not too much, giving you a look of surprise.
Too high could be bad.
Correct. Eyelids, if there's extra skin, the skin needs to be removed, and fat needs to be removed judiciously so you don't get a hollowed out look. Nasolabial folds can be improved or made less dramatic by a mid-facelift that's accomplished through what I'm talking about, a traditional lift. And the neck has to be addressed the same way with resuspending the neck muscles and removing the excess skin only. And that's
and you can look 10 or 15 years younger.
Absolutely. It's as hard or as easy as that.
Because 60 or 70 is very young today. I mean, people are living a long time. So what should they look for, in your opinion, in a doctor that's going to be doing a facelift, a surgeon?
They need to find somebody that has a great reputation in the community. They need to meet some of their patients, and it's usually some of their friends who've had these procedures already. They have to trust that this is the most important operation that they're doing. You know, you have to treat each of your patients that way. You have to be meticulous, have attention to detail, and have an artistic eye. And most of all, you have to love what you do.
Okay, and you love it.
Absolutely.
Facelift, one of your favorite procedures, by the way?
It is. I'm really lucky to be doing a job that I enjoy so much.
I want to thank you for coming on the show. Always a pleasure to have you.
Thank you for having me. It's great to be here again.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, this will be on your website as well. We'll also have it on wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.